Hi, and welcome to this episode of the ASHA podcast. I'm Fred Wyatt with the American Sexual Health Association, ASHA. January is Cervical Health Awareness Month, so we're talking today about issues around cervical cancer. We have three very special guests, and let me start by saying hello to Alicia Reiner. She's an actress, an activist, and a producer, and you've seen her in shows like Better Things and Orange is the New Black, where she plays one of the best characters ever, Natalie Figueroa. Hello, Alicia. Thank you for taking the time. Oh, we're so glad to have you. We also have a couple of members of the ASHA leadership with us, Dr. Maria Trent, a pediatrician and division director for adolescent and young adult medicine, and Bloomberg Endowed Professor of American Health at Johns Hopkins University in Baltimore. She's also a member of ASHA's board of directors, so she's kind of my boss. Dr. Trent, thank you for taking time to meet with us today.
Wonderful to be here.
It's wonderful to have you. And speaking of bosses, Lynn Barkley, ASHA's president and CEO, she's with us, and she's really the one who pulled this episode together. So what do you think, Madam President? Are we ready to roll?
I think we are ready. I was so excited when these two amazing women agreed to do this for us. This message is so very important, and anybody who is listening has to know it. And if you don't know it, you will by the end. So thank you. And I will try very hard to be quiet.
All right. Well, no worries. First time for everything, right? So, all right.
Thank you, Fred.
All right. So I hope I still have a job after this. All right. Well, Alicia, let me start with you. So it was a couple of weeks ago, you reached out to Len about January being Cervical Health Awareness Month to see how we might work together. And I know that you have a personal story here. So tell me, what is your interest around cervical cancer advocacy?
Sure. I want to start by saying thank you guys so much for all that you do. And I think it is so important that we talk about this stuff and that we help people be educated. And the reason I am here is because a couple years after I had my daughter, I had my first unusual pap smear and went through so much fear and so much discomfort around it, and ended up having a LEAP procedure, which I'm sure we will get to talking about later. But it was what that experience made me realize is, as a young woman, I was always taught the importance of having a pap smear, but I wasn't really taught why. And I wasn't taught what, I learned more about my cervix getting pregnant than anything else. I didn't really know, what is a cervix and what is cervical cancer? And it's not something we talk about. It's something, in my experience, whenever you hear cervical cancer or ovarian cancer, all I know is it's very grave and scary and nobody wants to talk about it. And recently, one of my girlfriends, who's just 30, had an abnormal pap and had to have a biopsy, and is sort of in a very similar place to where I was, and is trying to decide, does she want to do the LEAP? And I am really interested in sharing this information with women more and mothers more and men more, quite frankly. As we talk about HPV, it's it's not just women. So I really am excited to share this information that I'm not going to be doing the sharing. The doctor will be doing the sharing, but to have the conversation, and I'm sure I will leave here learning more than any of you. And I hope your audience does as well.
So you brought up a couple of terms there that we will absolutely want to talk with Dr. Trent about. But let me ask you, Alicia, about, you mentioned HPV, the human papilloma virus. And of course, there are many different types of HPV, and some of the high-risk types are the ones that cause almost all cases of cervical cancer. I'm just curious, did you know anything about HPV before your diagnosis, or how did that come up in discussions with your healthcare team?
Zero. I knew absolutely zero, because I was an adult, and this was before the vaccine, and I did know that when I knew zero. I would say I knew zero. I knew zero about HPV and that it had any relationship to cancer. I didn't know that it was possible that a virus could have anything to do with cancer. That sounded like those two things shouldn't have anything to do with each other. That's not what cancer is not about. Viruses have nothing to do with cancer. That was a ridiculous concept to me. And I'm sharing my ignorance here in all honesty so that people don't feel stupid. Like I consider myself fairly intelligent, college educated woman. And these were things I simply did not know.
And let me suggest it's probably not your fault. A lot of people don't know about these things. Dr. Trent, let me ask you about HPV and how you discuss it with parents and young people. And I'm guessing in your practice, this is often a vaccine discussion. I mean, how do you talk about HPV?
So, interesting, the discussion has changed considerably over time. So I'm a pediatrician, but my area of expertise is in adolescent and young adult health. So I'm a subspecialist who really sees young people aged 11 through 25. And for many years, we were doing a lot of the kind of preventive services work that I think we've been talking about here with PAP testing and follow-up PAP testing and sending people for extra special exams so we could see whether or not it was precancerous or not. So we did a lot of that work as people who care for this age population, particularly young people who were sexually active. Now, what I will say is that vaccination has really changed the game for us all together. And so what we're seeing is HPV vaccination has really shifted the type of care that we're delivering in adolescent and young adult healthcare. The new recommendations are even saying move from 21 to 25 to start PAP testing, unless you have some reason to suspect something else is going on. So I think that what we've seen is a shift because we now understand how HPV works in the systems of young women. But I think we also have been able to really eliminate some unnecessary procedures in women, given that 99% of what we see in cervical cancer is really tied to those high-risk HPV types that are in the vaccine. So from a pediatric perspective, I think that now we have new tools and innovation has enabled us to really shift public health around cervical cancer. And you can see the differences in the number of cases we see here in the United States, certainly with adverse outcomes compared to, say, other countries who don't have access to vaccination. So I think the conversation really shifts around, as you say, to vaccines more than, oh, I've got to get your daughter ready for a PAP test, or young woman, it's time for you to get your PAP test, because we're really doing PAP testing now almost as an exit from our clinic. So we're packaging people for young adulthood at just before their 26th birthday. And that's when they're getting their PAP test really now.
And I would love it if you would just lay out in the most basic way for people, what is a PAP test? Why do we get it? What does it test for? And same with, the vaccine, and what is HPV?
Sure. So HPV is the human papillomavirus. It is a virus that is linked to cervical cancer. And so is something that we certainly want to prevent in individuals. And while people don't like having pelvic exams, the reality is that they're life-saving for women. And so basically a PAP test, it's become better over time. It used to be 2 things that you had to use, but now there's just this one brush, this big brush that you just brush the outside of the cervix with. It's not painful, although sometimes people can have a little cramping. It's just a light brushing around the cervix. And then we put it in a little, it's like a short test tube, but it's like a little short container that has some fluid in it that allows it to be tested in the lab. Not only can we look at the cells from that, we can now do HPV testing, which they've incorporated into an algorithm to help us to really guide people about their risk. It's really just a value-added piece to a pelvic exam that people could be having or should be having on a regular basis as a part of their sort of well woman care. It's interesting because there's some data that may suggest that we may be able to even collect the cells without doing a full pelvic exam. But for now, our PAP, we're still doing PAP testing, and that's with just the brush around the cervix, and very simple. Just takes the whole thing takes just a few minutes. It's really not cumbersome, but I think it's very much value added. I would say for our patients, younger patients, sometimes they have not had a pelvic exam. And so oftentimes we're the first people to do a pelvic exam. We have that honor. And so we want to make it as gentle and not very scary at all. And so we do a lot of talking through, but I think for most adult women, it's a really easy procedure. And for women who've had children, it's nothing compared to childbirth. I mean, it's nothing compared to all the many pelvic exams you have to check for the baby, so or what the cervix is doing then. So it's really a minor thing. I think it's invasive for many people, and we have to be thoughtful about people who have a history of trauma, but it's a really sort of everyday thing. And to collect the cells. And then as far as the vaccine goes, they make the vaccine, our body responds to different kinds of proteins. We have a lot of talk about vaccines in the public. So the HPV vaccine doesn't have any live virus. It's not a live vaccine. It's an inactivated vaccine that has proteins in it that it has the multiple vaccine types. There are different manufacturers, but there's one that has all the high-risk types that include those that cause cervical cancer, as well as those that cause genital warts. And so really a comprehensive vaccine that really protects people. I think the reason people talk about the population I serve so often is because it works best if we get people before they start having sex. And so people are really reluctant. We can give the vaccine to people as early as age 9, but usually give it at the 11 to 12-year-old visit. And oftentimes people are like, oh, I just can't, I'm not ready to have the talk. And I am one of those parents. I can tell you, I never ask people to do things I'm not willing to do myself. We had a talk with my daughter and my son before we put them on that bus for kindergarten. So we started having these series. I got a book and we read a book with them. And we start the talks very developmentally appropriate. But who can touch you, what your body parts are, those kind of basic things. And over time, the discussion evolves. So by the time they're 11, we say you have to get this shot, because sometimes later on when people are in relationships and they start to be intimate, there's this risk for this virus. And this is what the shot is for. Now, what I will say, and I have said to parents, is I'm not sure that you have to have the big sex talk because you want to give your 11-year-old the vaccine today. I don't think that that's a requirement. I think you're not giving them a big talk other than to say, you're going to get this Tdap shot because if, it protects you against a respiratory infection but it also, if you step on a nail, you're covered, right? So I think some very simple explanations as to why you need to protect your teen are important. I do think we should be having those talks around sex and sexuality, but I don't think it has to be linked to the vaccine in the way that I think people have these big fears. I also think that providers have to be very open-minded about making sure that people have access, because they're counting on us to really say, this is what your child needs today. So I think in long and short, vaccine is just our body's response to some proteins that are going to be identified as HPV type proteins, and the body creates an immune response. And so when they would see the virus, they're immune to it. So that becomes an issue, and it has to be before they have had that vaccine type. But what I will say is that oftentimes people may have been exposed to one vaccine type, say they've had sex. So there is value to the vaccine for young people and young adults in particular who have had sex, because they may not have been exposed to all the vaccine types. And so they may have been exposed to one, but not several others. And so it's really important that people embrace this notion of vaccines over time. You just have had more exposures the more sexual intercourse you've had, particularly unprotected. So I think that there's a ton of value in both vaccine, but also preventative service and pelvic exams, PAP testing for women. Over time, I think it's the thing that has changed, I think, public health outcomes related to cervical cancer in the United States. And I think it'd be great if we could think about Cervical Cancer Awareness Week more globally, because I think that there's still almost 500,000 cases, if not more, women around the globe who are diagnosed every year. And so it's still a problem that has global implications. And we're doing really well here if we can get people in.
First of all, I actually just want to put a personal experience into having the sex talk early.
Yeah.
I think, if you're listening and you have small children, it's so much easier if you start early and then it becomes part of your family's lexicon forever. And I think it's also, we're specifically obviously talking about cervical cancer here, but there are so many aspects to your child's body and owning their own power over their body. And really, let's see, I want to say this. There's a word that I'm looking for. So let's pause there. I'm going to think of the word.
Sure.
Not
Autonomy.
Not autonomy. It starts with an A.
Agency.
Agency. Thank you.
Yeah.
So let's try that again. I just want to pause here, and I have a couple of follow-up questions, but I do want to put in a pitch to what you were saying, Dr. Trent, about the importance of having these conversations early. And I started having these conversations with my daughter when she was about a year old. Like as soon as language was in the picture and we were in the bathroom, we would start to talk about the parts of our bodies and that nobody gets to touch those parts of the body, and the importance of your child having agency over their own body and having a voice about that. And that voice can't happen unless you as parent have the courage to have that voice first and help them have the language, so that then at age, now I have a 13-year-old, by the age of 13, we've had this conversation so many times, pretty much at least twice a year, every year, that it's a normal conversation. It's not that scary. And my pitch here really is, don't wait till 11 or the teens when it's uncomfortable and they're in an uncomfortable phase about bodies and language already. Start early so that it's part of your vocabulary as a parent early. And in reference to the follow-up questions, obviously, because of COVID-19, we're talking about vaccines in a very different way than we ever have. And I would love you to share with the audience two very specific things. One is, we're talking about mutation of virus a lot right now, with how there are new mutations, and do the vaccines help for these new mutations? If you can speak to that about HPV, that would be really, really helpful. And additionally, you mentioned that it's not a live virus. Is this an mRNA virus? Vaccine? What kind of vaccine is this? So that people have more clarity and education about those things.
So it's interesting. It's important that people understand that the COVID-19 vaccine and the COVID-19 pandemic is really something that's quite different. I think people sort of say that it's new, but in reality, people have been working on these mRNA vaccines for a very long time. And so that's why they've been able to develop them for effectiveness. But it's kind of like every year when we get a flu vaccine, people keep saying, well, why do I have to get one every year? And I think it's in part because we expect some different flu vaccines. We expect some different types of flu that would occur. And so I think what we've seen, though, with HPV is we've not seen the kinds of mutations or changes that we've seen in something as fluid as the COVID-19 vaccine. So I would not necessarily put these two in the same category. So we have some vaccines that we sort of get and we're covered. There has been no indication that people will need a booster. And so I don't, that in and of itself is I think just it's a different disease process.
To be
HPV
clear,
is very slow. It's a very slow process. That's what we've sort of learned by actually studying adolescents over time, which is why it sort of starts at 25. Many people will be exposed to HPV and actually clear the infection. And so there are all these other components that I think people should understand. The vaccine, I don't call him by name, but there's one that is a non-valent vaccine, recombinant tissue, recombinant materials. And again, these are proteins that the body will show to the body, right? So they have these protein types, and the body will respond, will have an immune response to those proteins that then will protect the person over time. I think beyond that, I think what people should know is that there's no live HPV being injected into their child. And I think that that's the most important thing people should understand about the vaccination process for HPV. But the fact that we're covering even more vaccine types, I think, than the original vaccine. There was one with 2 types and one with 4 types. And now we have a 9-valent vaccine that's now available that covers even more types, I think is really critically important. And what's really cool is that it's highly recommended. It's been vetted by the CDC. Millions and millions of doses have been given worldwide. There are other countries, when you look at Australia, where they have virtually given it in school. It's been virtually eliminated there. People are not seeing the kind of disease that we see here. And so I think our ability to embrace this is natural and normal is important. What's interesting is there's something in it, they call it an adjuvant, something that makes it work better. And it's the same adjuvant that we've seen used in the hepatitis B vaccine. And so I think people, sometimes for me, it becomes a sort of a hang up that people have around the association with sexual behavior in adolescence during this time when parents are really worried about everything. And then they have to deal with this. But what I know is that we give another vaccine that's associated with sexual behavior. It's actually associated with IV drug use. And no one looks at their 2-day-old infant and says, I think these things are going to happen to my child. They look and say, I want to do everything I can to keep my baby safe. And so we give hepatitis B vaccine on day 2 or 3 of life before people even leave the hospital. And so the safety profile of the HPV vaccine has the same adjuvant. It's obviously they're different proteins, obviously to a different virus. But I think when I think about it, to me, it's sort of like saying, well, what's different now? Why don't we want to do everything to protect our child? They have so much more autonomy. They're moving into the space where you're not with them all the time. Why wouldn't we want to protect them? And sometimes they do make choices that we don't agree with, or they make choices that they regret later. Or they get hurt, or they do absolutely nothing. They have no sex at all, but they may marry someone, for example, who then has plenty of HPV exposure, and then they're suddenly exposed. How can we prevent that? And I think that when we give them vaccinations, it's our way of really showing them how much we love them. It doesn't mean we doubt them or their ability. It really is an investment in their future. And it's a part of the safety net. So I think that's how I see this whole process of both vaccination in this era. Now, I think you're right that we don't want people to stop thinking about vaccines. It's a really important of our public health infrastructure and public health practice. It's so important, probably now more than ever. I think people have gotten exhausted, but I think around this particular issue, I think we can't lose focus. And that's why I think this Cervical Cancer Awareness Week is so important. And us thinking about all the things that we have in our toolbox, be it vaccines, be it Pap testing, be it talking to people. So they talk about whether or not they've had exposure. They talk about family history. They have an opportunity to really share. I think there are tons of things we can do to keep young women and young men safe from this particular disease. I think the health-related quality of life impacts on women and men can be quite significant. We didn't even talk about men that much because it's Cervical Cancer Awareness Week, but there can be significant impacts across gender.
Just so, because I don't even know, is the HPV vaccine something that you do give to boys as well.
Absolutely, absolutely. And because we want to have a complete circle of safety around everybody. And sexuality is quite fluid, gender is fluid. And I think that what we've seen, and I think it's really important that we understand people's sexual practices, but the reality is there's protective effects for young men and young women. And there are even protective effects. We also want to prevent cervical cancer in infants. There's respiratory papillomatosis that occurs in infants, and we want to prevent their early exposure. So I think that the impact of vaccination is far reaching. I think the impact of surveillance, helping women take good care of themselves and have preventive services and access to preventive services, which is a huge issue right now in the United States. That's also important this week, us thinking about where women going to get good gynecologic care. Where are those services for young women, like college-age women who need great reproductive health care? Where are those services for poor and vulnerable women who may need care at free or low cost? Because I think that those are going to be essential aspects of us being able to do the kind of work we need to do around cervical cancer prevention.
Dr. Trent, you mentioned earlier that the vaccine can be given as young as age 9 and routinely at ages 11 and 12. And, I'm just wondering, do you ever get pushback from parents on that aspect? Why so young?
Because it works better when they're younger. The data show that they have a really robust response to the vaccine when they're younger. So that's A. But the biggest reason is because people aren't usually having sexual intercourse, right? Before their 11, 12-year-old birthday. I think when you get into the 15 to 19-year-old age group, that's when you see sexual intercourse begin in young people. And half of young people have had sexual intercourse by the time they graduate from high school in the United States. And I know people are like, oh, not my young person. But I just think it's somebody's young person. And I don't think you can predict that it's going to be your young person or not. And so I think that those figures really emphasize for me how important it is that we start beforehand. But it's also because they have a very robust response to the vaccine.
Yeah. And where my mind went with that as well, we want to have the tetanus shot in place before you step on the nail, right? Not after. Well, this is not so different. So there you go. All right.
Yeah, so that won't be their first, that's not their first tetanus vaccine. They've already been getting those. So this is just their tetanus booster. So they get boosters for other things, right? But what I will say is the other thing is adolescent care falls off over time. So I think that the 11 to 12-year-old visit is also one in which people are still coming in with their young person consistently, and where they can advocate for their child to receive vaccination. So I think it's an important transitional visit. Many adolescents begin to seek care on their own, maybe not 13 or 14, but certainly in the 15 to 19-year-old age group, there are many places where they can seek care alone, but they still need, which some people argue should change, permission, consent for vaccines, and that becomes a complicated issue if they're there for confidential care. So that 11 to 12-year-old visit really represents, it's an easy visit from a parent perspective, communication perspective. They're still coming in for routine care, and it's before they've started having sexual intercourse.
I'm going to go off script just for a second. Lynn, remind me, didn't you tell me a few years ago you were having some interactions with one of your healthcare providers, maybe it's even about your kids and the vaccines, where you took some of Ash's publications on HPV and the vaccines? I think you gave them to the pediatrician or to the doctor. You had to educate them about all this. Am I remembering that right?
Yeah, my kids are not young. My baby is 27.
Well, there you go.
So when he was going in for his sports physical, the vaccine had just been approved a few months before for males. And when I said to my husband, I'm taking him this year. And so because I wanted to make sure he got the vaccine. And when I said to his doctor, I said, so what's your position on the HPV vaccine for males? He said, I don't know. I said, that's okay, I do. So I did give him some materials, and, of course, they give the vaccine routinely now, which is great. Which is what doctors really need to be doing, not questioning it, just, here, it's time for your shot, let's do this. Let me, if I may, let me jump in and ask a question. So, Maria, you've talked a lot about, obviously, the vaccine, which is so critically important, and Pap test, but there's also the HPV test. And I don't think people, one, know about it, two, understand the benefit of the HPV test. And so can you talk just a little bit about that? And Alicia, I don't mean to jump on you, and I said I'd be quiet, but apparently I can't.
Yeah, I mean, I think it does checks cells for to see whether or not you have a high-risk type of HPV. I think that most of us in professional offices are using that in conjunction still with Pap testing to determine how frequent you also need Pap testing. So I think it's a wonderful adjunct. I think for many years, people pushed back on its use in isolation, in part because sometimes people can clear those infections and they want to know whether or not you're actually having those changes in the cells that are on your cervix. But I think it's innovation in terms of our ability to detect whether somebody has a high-risk HPV type or not is really critically important, particularly when we see subtle changes. There's a spectrum. There are low-grade changes and there are high-grade changes, and then goes to frank cancer. So there are all those things. They have some cells, something called ASCAs, which is like atypical cells of undetermined significance. So there's a range of cell types, but I think that your HPV test helps us to really, the typing helps us to determine whether or not you're carrying a high-risk HPV type or not, and how we need to do surveillance with that patient.
And I have a question, a little bit of a follow-up to that, which is, of the patients you see, those who are sexually active, so women over a certain age, I don't want to give an age because I don't want anyone to have a certain feeling about what age is appropriate. But how many of them are positive for HPV, for some form of HPV?
So I think it's age dependent. So that's the other. I think it's more frequently in patients who are a little bit older, but the reality is that we have stopped doing as many Pap tests and HPV tests in young women now. And so for my population, they're going to be the older cohort, in part because we aren't getting data anymore from the younger cohort. But even so, it's a very small population of people who don't clear. So I think in the past, we certainly saw abnormal cells and low-grade changes, but oftentimes, patients, we would repeat those and they would be better. It doesn't mean they still aren't carrying sort of HPV in their system. It just means that those individuals have been able to clear that infection from their cervix, which I think is really important. And I think because we were spending so much money and time and effort and patient discomfort and worry for so many of those people to clear, really meant that we should focus on the slightly older young adult woman. So I would say that in my population, they're definitely going to be the older populations, but I'm not seeing it as much I'm definitely not doing as much Pap testing, and I'm certainly not seeing as many abnormal Paps, in part because of the volume coming in, but I just don't see it as much as I used to, and it's because we're vaccinating so many people. I think what's wonderful is, we really serve a mixed group of people, low income, patients in our primary care practice, but also young women who are insured but need confidentiality or underinsured in our practice. And so we are fortunate that we're able to have certainly vaccine through a program so that it's no cost to most of our patients. And then we're also able to do the reproductive health care for the young adult woman. So it's really, in my practice, it's going to be the older. It's going to be people who are 21 to 25, sort of the people who were left over in the switch that is occurring. And then really it's going to be mostly our 25-year-old patients that we're seeing. But amongst them, it's actually quite rare now. It's actually, I mean, we have a system where we follow up all of them and send them a letter and that kind of thing. So, because I think people are waiting for their results and want to know what to do about it. But it's actually quite rare in young people now. But it means that that 25-year-old woman, that 25, the age group you describe is really that woman in transition. I think it really means that she has to take a hold of her healthcare. She has to really, we often think what happens to our young people when because we're very, I don't know, supportive, it's just like a nurturing place. And, the adult world from a healthcare perspective is very different. You come if you want to come. If you don't come, I'm not calling you, I'm not checking to see where you are, right? Perhaps, especially if you're new, you never come. So whereas we call patients and follow up and do a lot of that, I don't call it parenting, but I would call it scaffolding so that people can have autonomy. And so I worry about the 25 to 30-year-olds sometimes, just because you want them to get used to having a provider, a person they can trust, feeling comfortable with exams. I think that's all really very important still for them.
Yeah.
Let me ask you, Alicia. I mean, we've been talking about HPV and vaccines here at ASHA for years, and we're always interested in hearing what others are saying, maybe get a fresh take on it. So you've just had a crash course in all this stuff. So put on your activist hat. Let's say you're going to give an elevator speech to a parent who's, I don't know. I mean, I don't know if my kids need it, that kind of thing. What would you like to say to parents to make sure they understand why the vaccine is important?
Such a good question. I would simply say educate yourself, like find out more about it from reputable sources. And reputable sources are a very important part of that sentence. From the Pediatric Association, from the CDC, from doctors you trust. Do the research. For me, one of the things I've learned today is the statistics. I'm all about statistics and the numbers. And if you say to me, 99% of cervical cancer is based on virus, and we have a vaccine, so you don't have to get that virus, that's hard statistics to beat. And that's hard science, and I believe in science. And so that's what I'd say. I'd also share, my personal story, because I was in puberty and a teenager before the vaccine, and I have one of those experiences. Again, I didn't understand. It was all such new language for me when it was happening. So it was like, oh, you tested positive. We're going to wait 6 months to see if you clear this. And I was like, what? I didn't even understand what that means. And that's really scary for young women to hear. And I think we need to have these conversations more and talk about, what does that mean? What does that mean? Clear the virus? Like, nobody explained that to me. And then when I didn't clear the virus, like, what does that mean? And oh, we see some precancerous cells. The minute you say precancerous cells about a body, it has so many emotional reactions. And the fact that 99% of the time around this issue, I imagine, that's not a statistic, this is my imagining, most women haven't heard of these things before, and it's really rather shocking and upsetting. And that's, again, why I'm here having this conversation. Is one of my best friends is going through it right now. And just simply me being able to say to her, hey, I went through that, you're gonna be okay, was so helpful, because we are not educated about this. It is not part of what you learn. Just like, we learn birth control, but we don't learn this stuff. Like, my mom never told me about what happens if you don't clear the virus, or if you have precancerous cells. Like, that was not part of my sexual education. And I think it needs to be. I think we need to have these conversations, just like We need to have conversations about endometriosis, and we need to have, there's a lot of conversations about the female body that we need to have more, so that women feel more ownership and empowered within their bodies, and to have more choice. And I will say, you know, I would love it if you'd also talk a little bit about a leap and what that is, because I had no idea. And I guess once you share that, I will share the end of my story. And to me, it's yet another reason why you might really want to think about taking the vaccine.
Sure. So the two things I'll say, the first one is I have this vision, it's this dream that they will be at elementary school science fairs around the United States, the life cycle of the human being, or someone does one on cervical cancer, and they present the stages of cervical cancer and the timeline it takes to move from those places. I mean, those are the kinds of things that we never see the human body. We'll see the life cycle of a fruit fly, but never a human body. And so it's interesting. I think these topics could be totally safe spaces for young people from a scientific perspective, with a little support, if we thought about it. The second thing is you talked about your procedure. So basically, a LEAP is when you have loop electrosurgical excision procedure. So basically, there's a heated wire loop that is heated electrically, and it's used to essentially just scrape the cells off of the surface of the cervix for both diagnostic reasons, but also for treatment reasons, because removal of that sometimes for many people can be an effective way to keep the cells from spreading, right? So I think that's the thing I think that you're having. Now, the experience of it, I would have to say you would be able to speak more thoughtfully about what it feels like as the patient, but essentially that's what's happening during the procedure.
Thank you. And I will share that. So I did have that procedure because I didn't clear the virus. They were seeing more, like we kept on, I'm a big watch and wait kind of gal. They kept on seeing more cells, and it was time. And it was definitely a painful procedure. I also, unfortunately, had a, what would you call it? A complication, I guess you would say. And I then, in my healing a couple days later, hemorrhaged. And it was dangerous and scary, and I had to go to the emergency room. And I've actually never talked about this in public. And I have heard said that it may have been more complicated and more difficult to get pregnant after that. And I wasn't able to get pregnant after that because of all that happened. And I share that because I think it's a piece of the puzzle in thinking about these choices. Like, we have to not just think about, oh, well, I don't want to put this vaccine in my body if I don't know, like HPV is kind of rare, and I don't know if I need, like, the stories we may tell ourselves. But I think it's really important to look at all aspects. And that's what I really mean when I say educate yourself. Learn what, like, okay, why am I having this vaccine? And what happens if I don't have this vaccine? What does it look like when you don't clear the virus? What does it look like when you have precancerous cells? When that happens, what happens to a body, and what are your statistics in that direction? I think it's really important to look at everything from a 360-degree point of view, look at all sides of it. And having experienced what I experienced, I have no qualms about my daughter getting the vaccine. because I never want her to go through that. So if there's a way to keep her safe, as you said, Dr. Trent, that's something I'm really interested in.
That's thank you for sharing that. We always say that the patients have some of the most authentic voices that we can tap into because you've been through it, and I appreciate you for sharing that. Alicia, let me just continue with that just for one more point. Just thinking back on your experience, I mean, if you're talking to somebody who's just starting this journey, they've just had their first abnormal screening test, they're in the oh my God kind of moment.
Yeah.
What would be one or two things that maybe you wish you would have known that could have made it a little bit easier? Anything in particular?
You're not alone. I think the biggest thing is you're not alone. And even though similar to miscarriage or similar to a lot of female health issues, even abortion, women don't talk about these things. It doesn't mean it's not happening. And it's scary to talk about. I think sometimes we as a society think if I don't talk about it, it won't be real. And I think it's quite the opposite. The more we don't talk about things, the more they grow and fester. And one of the magical things about our planet today is in this technological information age, we can share information more easily, just the way we are today on a podcast, on a Zoom, on a multitude of channels. And it's really important that we share this information and not be afraid of it. Cancer is such a scary word for so many people. And this one's a biggie for me that I feel strongly about because it's preventable. It's a preventable cancer, that's rare, right? There's, we all know healthy diet and exercise and meditation and all the good juicy stuff, don't smoke too much. We know what we're supposed to do with our bodies, but it's really rare that we can say, I can't think of any other cancer where you can say, oh, it's preventable. That's kind of magic. And I think we really want to use the tools we have.
There you go. We are near the end of our time, but I have to ask Dr. Trent just quickly about the challenges of healthcare delivery in the age of COVID. I mean, I've heard a statistic that we are running a deficit in HPV vaccines of something like 1 million or however many doses, whatever the number is. It's a lot. Would you just speak to that? What is it like for you and your colleagues to deliver these services in the middle of a pandemic?
So I think it depends on whether there's a surge or not. I think the challenge becomes how many people we can see in a day. And get them into the office. Only a certain number of people we can have in the office at one time. Although I think those numbers have gone closer to normal now. We've not had any trouble with our core vaccine, certainly in our office. So we're able to actually, if we're able to get people in, we're able to vaccinate them. And we actually made vaccination a priority in our clinic. So people who were due, certainly infants who were in that first year of life who need multiple vaccinations, but also our adolescents were an additional priority for us who were due for vaccination. And so I think we have to continue to prioritize that during COVID. What I will say is I think sometimes it's the procedures, maybe some of those that sort of have been described today. I think getting in for, I think procedures that people consider important, but they may not be acute. I think that's much harder. I do want to say though that even though I think sometimes people can experience complications from procedures, those like the LEAP for many people can be, really life-changing and life-saving. So I think it's important that people talk to their doctor about the risks and the benefits when they go in so they know what to expect, including sometimes the things that may not go well with the procedure. They also have to take adequate time to really heal afterwards so that that tissue has a chance to grow back. So I think that, but I think it's those procedures during COVID COVID that I think may be a challenge. What we're hearing from our surgical colleagues is getting people in, but I think our OBGYN team has been really thoughtful about our ability to sort of see people. I think the final challenge is getting people to want to come to medical facilities during COVID. And so I think we have to think more about use of telemedicine as a way to sort of screen people, figure out who needs what, and then triage people effectively for services so that no one falls through the cracks. Because I think I would worry about the people who need vaccination. I mean, I think there's a tricky time window in adolescent health. We definitely want to get the early ones in. But I think we also want to deliver really high quality reproductive health services to women, even during COVID. And so even if that's a quick telemedicine visit with a triage and a short visit or a vaccination or whatever it is, I think we have to use our resources very effectively to do that. Because I think we've worked really hard to keep our institutions safe. I mean, I think certainly mask wearing and cleanliness is a high priority within those institutions. So I want to tell people that it is safe. We're all going to the grocery store. It's much less safe. People are going to sporting events, much less safe. People are on airplanes, perhaps much less safe. We're doing all we can to really keep people healthy while they're in the office. And I think missed care can be something that what we've seen is resulting in people having complications later.
That's great. Madam President, can I toss it over to you to thank our guests?
You know, we could have, to me, and we do live and breathe this all the time, but I learn something every time we have these conversations. And Alicia, I can't thank you enough for your heartfelt, really your stories and your challenges and your questions. And, so I hope we can do this again. And Maria, you are, as always, one of my very favorite people on the planet. And she clearly knows pretty much everything. Yeah, I know. I told you you'd really enjoy meeting her, Alicia. So thank you, Fred. That was awesome. And I can't wait for part 2.
This is amazing. There you go. Thank you all very much. I want to mention quickly, we've talked about a lot of terminology, a lot of tests and procedures and vaccines today. We have an interactive patient education tool called Understanding Cervical Cancer Prevention that really breaks all this down so nicely, whether you're entering screening, you've had an abnormal test, you need a follow-up, or you want to know about vaccines. We have versions in English and Spanish, and we'll put a link to that in the show notes. So I urge you to take it, to check it out. Thank you all for being with us today. Lynn, thank you for pulling this together on such quick notice. Thanks to everybody who listens, whether you're downloading or streaming. We really appreciate you. Keep in check because we'll have more good stuff to come. And take care, everybody.